The first step in preventing these injuries is becoming familiar with the risk and protective factors for these injuries. Risk factors are things that increase a person's chance of suffering an injury and should be avoided as much as possible. There is an entire category of risk factors called modifiable risk factors, which are risk factors that can be changed. These include things like low levels of fitness, high workloads, and poor movement quality, the way an individual moves. The way that children move when they jump and land or change speed and direction when they are running is the modifiable injury risk factor that coaches have the greatest opportunity to influence. To determine just how much movement quality is an issue among children, HSS researchers completed a study where nearly 500 children were observed performing several common movements and exercises, like squats, planks, and jumps. Unfortunately, these researchers found that only 21% of children between 8 and 11 years old, 29% of children between the ages of 12 and 15, and 21% of 16 and 17-year-old children were able to perform these exercises with proper technique. The inability to perform these types of activities with proper technique is an injury risk factor that can be changed with proper education and training. One of the most common movement quality issues we see in children is something called dynamic knee valgus. DKV is the scientific term used to describe the movement when the knee joints collapse inward toward each other during activities like jumping and landing or changing direction while running. The photo on the right side of the screen demonstrates dynamic knee valgus. When someone's knees move into this knock-knee position, forces on the sensitive structures like ligaments and cartilage increase significantly. While some athletes are forced into this position by physical contact, many athletes suffer non-contact injuries, demonstrated in this video on the screen. Movement is an important aspect of everyday life. Proper movement patterns should be taught early in childhood to provide the knowledge and skills children need to participate in physical activity with minimal risk of injury. Unfortunately, improper movement patterns dramatically increase the risk of injury and limit athletic potential among adolescents. Protective factors help to decrease the risk of injury and should be utilized as much as possible. Neuromuscular training has significant protective effects for adolescent athletes in clinical trials. Over the past 10 years, studies have shown that many injuries can be prevented if athletes perform NMT programs regularly when led by a trained sports medicine professional. Here are just a few of those studies. Throughout the rest of this course, we are going to provide you, coaches, with training so that you can lead your athletes through an NMT program the same way that these professionals do.